Okay.
Thank you.
Once again, good afternoon, everyone. So now for something a bit different. So far, we've heard so much about different injectables, hyaluronic acid, PLLA, biostimulation, and now something about enzymes. When we think of enzymes, the first thing actually we think of is digestion. But the enzymes are so much more. Actually, our body has around 75,000 enzymes that work as catalysts for around 55,000 chemical reactions. Enzymes are very common in different brands such as paper industry, food industry, chemical industry, but they're very difficult to find the perfect enzyme that can be injected into human body without causing any side effects. Now, there are a variety of different modalities and different things that we can do with the enzyme. One that is very specific and it creates great results is so-called double chin. So you're going to ask me, why enzymes? Well, to be frank with you, enzymes are extremely safe and they always deliver results. Why? Because enzymes are substrate specific. So let me just work on this patient and to show you, if we can show the patient, please. One of the indications for the enzymes that we're going to be talking about today briefly is double chin. Can we see? Can you show, please? Yeah, okay. So a lot of you in your clinical practices are probably dealing with this type of patients. So what do we do when we have a patient like this? Well, we try to tell them, go work out, have a diet. Then we try to heat the tissue, cool the tissue, and nothing works. And then we try to inject. And we try to inject something called chemical lipolysis. Now, all those chemical lipolysis are based on deoxycholic acid. Bear in mind, it's an acid and it's not tissue sensitive. And this is the reason why injecting double chin or any other part of the body with deoxycholic acid has a high complication rate, because deoxycholic acid is going to burn through everything it finds on its path. Enzymes, PB serum enzymes, are the only enzymes that are created through recombinant technology. What does that mean? It means that the enzyme will not create immunogenic reaction. Now, enzyme in its core, it is very safe because it binds to the substrate and only to the substrate. When we are talking about double chin, we are talking about the enzyme that is going to open up fat cells and it's going to release triglycerides. Once it opens up the cell, after it releases the triglycerides, the cell is going to close, meaning the cell is going to be intact and it's going to be vital. That is the main difference between enzyme treatment and all other chemical lipolysis that actually end up in necrosis. So PB serum not only works for double chin, it works for the entire body where you have localized fat deposits, but not just on the fat tissue. It has amazing and outstanding results when it comes to scar tissue, fibrosis, acne scars, and remodeling of extracellular matrix. Why? Because we combine 5 different types of enzymes. We combine lipase, lyase, collagenase, sometimes hyaluronidase, and even keratinase. Today, we're going to show you how injecting very superficially into the preplatysmal fat pad can actually be a great add-on to remove excess fat, whether you're going to use it as a single treatment or you are going to use it in conjunction with some energy-based device. Now, the story about the enzyme is that enzymes have a very short lifespan, so you have to prepare them immediately before you're going to inject them, and you cannot put them in refrigerator. The product actually comes in a box like this, This is the PB serum medium. Medium stands for that it has a higher amount of lipase enzyme that is actually specific and is going to dissolve fat tissue. Inside, you will find the enzymes itself. You're going to find dilutant, because you can dilute the product up to 20 mL, and you're going to find 2 mL of non-crossed hyaluronic acid. So what you're going to do, you're going to firstly, you're going to take the hyaluronic acid and you're going to premix it with the enzymes. Now the enzymes here are lyophilized, meaning they're not active. Once you inject them, they will become active. Okay. And we're going to set that aside for a moment. We're going to use another syringe because in this patient we're going to inject 6 mL of the solution. Now we're going to draw 3.5 mL of dilutant from this vial. And we're going to place it into the syringe with hyaluronic acid. One more thing, enzymes are pH sensitive. That means that you can add a small amount of lidocaine, but not too much, because if you put too much lidocaine, you are going to change the pH of the solution and the enzymes will not work. So we've taken 0.5 mL of lidocaine and we're going to inject it just for patient comfort. Okay, and our solution now is ready. Okay. Now the injection part for the enzyme is very straightforward. It takes about a minute of your time and it doesn't require any specific learning curve. When we are treating the double chin, when you bend, you're just going to mark the area with the fat axis. Sorry. Back, 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 back. Perfect. Relax. And we're going to deposit 6 injection points. We're going to inject 1, 2, 3, 4, 5, and 6. Now, what's going to happen is after we inject the enzymes, the tissue is going to become red, sort of like inflammation, because what's going to happen is for the next 24 hours, there's going to be a large release of triglycerides. But since we're not working with one component, we're working with 3 enzymes, lyase and collagenase, is going to create a nice milieu where actually there will be no fibrosis, there will be no edema after the treatment. The important thing to emphasize is enzymes are temperature sensitive, meaning that if you increase the temperature of the tissue after the treatment, the enzymes will stop working. If you cool the tissue after the treatments, the enzymes will stop working. So for the next 24 hours, this patient cannot go to saunas, she cannot do any massages, she cannot cool the tissue because the chemical reaction will stop. Any questions so far?
Est-ce qu'il y a des questions au niveau de la salle?
Okay.
Okay, thank you. Continue.
So, and you can lean back, please. Enzymes work every single time. It's not like toxin. If you inject less, you will have less of a result. The main point is that once you've diluted the product, you have to inject all the amount in order to saturate the tissue with the enzymatic solution. So the injection is very simple. We're going to inject into preplatysmal fat because this is the indication. Lean back, and we're going to inject 1 ml of the product in each position. There we go. 2. It is 30, it's a 30 gauge needle, 13 millimeters. If you are working on the other part of the face, for example, acne scars, you can use up to 34 gauge, 4 ml, 4 millimeter needle. You want to saturate the tissue completely. Bend over, bend over, bend over. Perfect. Now, the question that may arise is, after we dissolve the fat cells, are we going to have skin laxity? To be honest, not that much. Usually, enzymatic treatments are followed by some energy-based devices like HIFU or radio frequency in order to create that lifting effect. This is medium, so now it looks worse because we've placed 6 ml of the product. What's going to happen over the next 24 hours, this is going to become even more swollen, it's going to become red. Like 2% of the population can sometimes have symptoms like sudden flu onset, and you do not want your patient to take any medicine, you do not want them to take ibuprofen, paracetamol, or something like that, because you're going to change the pH of the tissue. What's going to happen over the next 7 days, this fat deposit is going to become smaller and smaller. And that is, ladies and gentlemen, enzymatic therapy. It's very simple, it's very unique, and trust me, when I started working with these enzymes, I was a bit skeptical because do they really work? It is a great add-on, and it's like 95% ratio when it comes to patient expectations. But you have to realize that enzyme is tissue sensitive, it is specific. If you inject the product into tissue that doesn't have fat cells, you will not have results. The same works for treatments like acne scars. If you inject specific enzyme that targets fibrotic collagen, it will dissolve that collagen. But if you inject it into healthy tissue, you will not have results. Now, one other thing that will benefit this patient is definitely injecting products into the jowls. For jowls, we have different product. It's called LOW. PB serum LOW consists of 3 enzymes, consists of the same amount of lyase, lipase, and collagenase. Now, those enzymes in conjunction, they work to restructure and remodulate the extracellular matrix. What's going to happen is when you inject PB serum LOW into the pregio sulcus, first of all, it's going to become much more mobile. The extracellular matrix will become remodulated, and you will get a nice effect. Now, enzyme therapy in treatment is not the same as injectables. So when treating your patients and you basically have no idea what to do because your patients have been previously treated, they are over-treated, they don't want any more injectables in terms of volumization and filler, my go-to treatment always is try to inject them with enzymes because you're going to create a remodulating effect on the matrix. It's going to give them a nice tone and texture. They will see that something has changed on their face, but not in the sense of volume. Okay? Thank you.
Thank you. Thank you, Dr. Lovic. There is some question. Est-ce qu'il y a des questions au niveau de l'assistance pour l'injection des enzymes? 2 questions. On peut avoir un micro, s'il vous plaît? 3, 4.
Hi. Thank you for your presentation. I want to ask 2 questions, please. The solution, we can keep it how much time and or hours? And the second question is, can we combine in the same session the medium and the high for the skin laxity?
Okay, I understand the second question. The first I didn't quite get. You can combine products, definitely, specifically if you are working with patients who have cellulite. If you're treating your patients with cellulite, you combine product that has a high amount of collagenase, you're combining PB serum high, and you're combining PB serum medium, and therefore you're actually affecting all 4 reasons why cellulite is formed. In this patient, you can definitely combine, as I said earlier, PB medium, PB low, and if she had some scarring on her face, whether it's post-surgical scars, acne scars, you can definitely inject PB serum high. What you cannot do is you cannot immediately after this treatment do an energy-based device because you're going to heat the tissue, and if you heat the tissue, you are just like that going to stop the chemical reaction. If you're going to use some energy-based device, you have to use it the day after this treatment, or you have to cool the tissue before, okay? And what was the first question?
Another question?
30 minutes. 30 minutes after the enzymes have been activated, you can inject them. After that, they become unusable. That's the trick point. There's no way you can store them. The enzymes can be diluted up to 20 milliliters, depending on the area. For this, no more than 6 mL. But if you're using it on the body, you are going to dilute them with 20 milliliters, and that 20 milliliters is going to give you coverage of around 20 centimeters square, okay? If you are working on the body and you are dissolving fat deposits on the abdomen, flanks, you can use up to 3 kits of this product in the same session, no more than that. 20 ml dilution maximum, but you always have to inject the entire amount of product, because if you inject less product, you will deliver less amount of enzymes.
Alors, je voudrais remercier la société Omnium Pharma. On aurait aimé que Amine soit là pour plutôt le taquiner, non pas juste le remercier. Alors, Amine, Omnium Pharma, c'est Amine Fotona, d'accord? Donc, merci, docteur Lovic.
Can we ask Dr. Lovic to maybe come to the stage? Because there's some questions. Dr. Lovic, if he can maybe come to the stage.
Yes. They have some questions.
Because we have this time.
Yes, but I think maybe.
Thank you. Yes. Oh, sorry.
He didn't speak.
Yes.
Merci pour votre démonstration. J'ai 3 petites questions. Est-ce qu'on peut associer le HIFO et la radiofréquence? Deuxième question, quelles sont les contre-indications? Et troisième question, quels sont les effets indésirables? Merci beaucoup.
Okay, so why radio frequency? Because after you do 2 or 3 treatments with PB0 medium, you will lose the entire preplatysmal fat. And if you have a higher degree of double chin, you will end up with a loose skin. Okay? So after 2 or 3 sessions of PB serum, you want to get that tightening effect on the lower part of your face. Makes sense. Because unlike other procedures, they're actually targeting the fat in a way that they are destroying the fat and they create fibrosis. In this case, you will not get any inflammation or fibrosis that is going to create that tightening effect. You're going to preserve the tissue viable. And that's why you can have some loose skin in the lower chin. I hope that answers your question.
Yes, she asked also about side effects for this.
Okay, so
complications also.
Yeah, okay, so there are different enzymes that can deliver some side effects because the enzymes that are used widely are not produced through recombinant technology. What recombinant technology actually means is that they insert a part of DNA that is responsible for coding the product, the enzyme, into the bacteria, and then the bacteria mass produces the enzyme without any glycosylation chains. Now, enzyme is a 3D molecule, okay? And around the enzyme itself, it has a lot of glycosylation chains. Those glycosylations act to our dendritic cells. And when dendritic cells, immune cells, binds to that glycosylation chain, you have immune reaction. In these enzymes, since they don't have any glycosylation chains, you do not have those types of reactions. But you have to be aware that there can be some cross reactions in patients who have allergies to bee stings. And since you are actually releasing a large amount of triglycerides into the body, especially if you're working on the body, you can have flu-like symptoms because your body for the next 24 hours is going to be oversaturated with the triglycerides.
Okay.
That's the reason why you can have higher temperature, you can have fever, but if you have fever, do not give your patients paracetamol or Lupocet for the next 24 hours if the fever doesn't go above 38